This is the last lesson on modern medicine. Now, what we're going to cover in these, well, in quite a bit of a detail over the next few slides, is looking at lung cancer. So we're going to look at the cause and the treatment of lung cancer, and then also look at the prevention of lung cancer. Now, all of these can all be written in questions. Say, for example, you've got a question saying, explain why there was progress in the cause of disease. You could definitely talk about lung cancer, likewise with treatment and prevention, especially with treatment and prevention. So, there's some numbers here. It's a little challenge. Let's see if you think you know what these numbers link to in regards to smoking. So you've got 18, 2007, 85%, 70 to 74, and 5%. So pause the video, see if you can guess how these numbers link to smoking. Right, this is it. These are the numbers. So, 5% of children are regular smokers. 70 to 74 is the highest age range of diagnosis of people with lung cancer. 85% of cases of lung cancer are people who are smokers. 18 is the legal age that you are allowed to smoke. And in 2007, the legal age actually went up from 16 years old to 18. So, what we need to understand first is just how smoking has been represented in the past. Now, these are adverts from the 50s. Now, if you have a look at them, what these are doing, this is glorifying smoking. So you've got one TV advert there, more doctors smoke Camels than any other cigarettes. I mean, straight away, that's condoning smoking from doctors. That's saying that smoking is okay. Now, these adverts became less and less after the link between smoking and lung cancer became proven. Let's look at a few more. You've got the middle one there that says, my throat is safe with Craven A. You can trust their smoothness and quality. And then you've got a child saying, gee, mummy, you sure enjoy your Marlboro. Marlboro's a cigarette brand. Now, all of these things here, the purpose of this is to sell the cigarette, is to sell smoking, is to glamorize it. Now, at this time, the link between smoking and lung cancer during these adverts definitely would not have been something that was evident. Let's compare it to today's adverts. Straight away, you can see that today's adverts have more of a scare tactic behind them, telling you what the dangers of smoking are. Not just for yourself, but for people around you. And you've got that pretty shocking smoking poster there of the child being suffocated by secondhand smoke. The government have put quite a big campaign together to ensure that people realise the dangers of smoking. Even though this might cost the government money, they realise that the public health of their nation is very important. And that smoking can cause so many different health problems that to outline this and make people understand the risks is of paramount importance. So first thing then, cause and diagnosing lung cancer. So we're going to go through some information, and if you can complete this table. Main cause of lung cancer, why is it so hard to treat? And then we look at the diagnosing of lung cancer, look at the process that people go through to be diagnosed with this illness. So I'm going to underline a few bits as I go along. One of the main causes of lung cancer is external factors, such as smoking or exposure to chemicals, such as radon gas. This includes passive smoking when you're in a room with someone that smokes heavily. Lung cancer is one of the hardest cancers to treat. This is because at the time it's detected, it's already very advanced. This is usually because patients who may have a cough for a long time don't think anything of it. So patients mistake symptoms for other things. So like a cough for a long time, people might say it's a cold. Okay? So people don't see the link between certain symptoms and potential lung cancer. So another thing, compared to some other cancers in the country, such as breast cancer, where there's a national screening program, There is no national screening program for lung cancer, so you can't just go and get routinely tested. You have to be concerned that you have it before you get tested. Now, the reason why there's no screening program is because the tests at the moment are not accurate enough to justify exposing the patient to a dose of radiation. Now, this is really difficult, obviously, because it is something so difficult to identify. And by the time it's identified, you've just got to get lucky as to how far advanced it is. Now, diagnosing lung cancer has come a long way. Now, in the end of the 1800s, early 1900s, the chance is that you would have had just an X-ray machine. Now, the problem with an X-ray machine is it's really difficult to tell cancerous cells. And some issues might be mistook for others. So, for example, some people might be diagnosed with cancer when it wasn't. Now, today, cancer is diagnosed very, very differently to what it was early on in the modern period. And this is because of technological advancements. So firstly, the patient will be given a CT scan, which creates a detailed picture of the body. And for this, the patient will be injected with a dye so the lungs can be seen clearer. Now, if the patient does have cancer, they will go to stage 2 of diagnosis. So if the patient's cancer isn't advanced, the patient will be given a PET CT scan. It's basically a CT scan with radioactive material injected onto the lungs to help identify where the cancerous cells are. If the cancer is possibly advanced, the patient will have a bronchoscopy. Now, bronchoscopy is like an endoscope. Now, an endoscope is a little camera that goes down your throat, but a bronchoscopy will take a sample off your lungs and then be tested at a laboratory. Now, after all this has occurred, the doctor will then decide the treatment plan, the type of cancer, the stage you're at, and then go forward. So then there's the treatment, okay? Now remember, these are all treatments. They are not cures. That's one thing that people haven't got at this stage, is a definitive cure for this cancer. But treatments, there are a range. You've got lung removal, transplants, radiotherapy, chemotherapy, and genetic research. Some are more effective than others depending on both the patient and how they respond. It really does depend. So, if you have a lung removal, if you detect the cancer early, you can remove the tumour and the infected portion of the lung. So you can actually take out a portion of the lung that might be cancerous. In some cases, if it is very advanced, you can remove the entire lung. Now, this is effective because the infected tissue will be removed and people can breathe normally with one lung if they are waiting for a transplant. Okay, so it is something that can happen, and it is something that's very common to remove the cancerous cells without having to have a massive dose of chemotherapy, radiotherapy, etc. Transplants. Now, this is where you replace the cancerous lung with a transplant from a healthy donor. Now, the impact of this has been a lot of argument in society. There's an ethical problem. Should a new organ be given to someone if they choose to ruin their own? Now, you've got to be careful with this because actually, yes, although a majority of lung cancer cases are from smokers, there are still a high proportion of people that develop lung cancer through, coming into contact with radon gas, through secondhand passive smoking. So there is that ethical problem there, okay? So transplants can happen where the cancerous lung is replaced from a healthy donor, and that donor might come from someone who is a donor, an organ donor, okay? Someone who decides to give their organs up after they pass away. Radiotherapy is another form. Now, what happens with radiotherapy is that there is a wave of radiation that is aimed at the tumour from outside the body. Now, you can place a small piece of radioactive material next to a tumour using a tube called a catheter. Now, why is this so effective? Well, firstly, you can shrink the tumour without needing surgery. And then larger tumours can be prevented from growing bigger. So it is a preventative method from either making it get worse or also trying to shrink the tumour without needing surgery, which again will be beneficial for the patient. Chemotherapy is where patients are injected with many different drugs. Now, this is a very difficult form of treatment. It has a lot of serious side effects, but the impact of an effectiveness is that it does shrink the tumour before surgery, or it can do. It can prevent cancer from reoccurring, and it can also provide relief from symptoms when surgery is not possible. But again, chemotherapy and also radiotherapy can have pretty nasty side effects, which for the patient is very difficult. And then we've also got genetic research. Now, scientists are beginning to study the genes of lung cancer sufferers to help doctors prescribe more effective treatments. Now, this is way off from being an effective treatment, but there has been some progress, and it's seen that some chemotherapy drugs work better in lung cancer patients whose tumours have a certain genetic mutation. So they're looking at the different tumours that you can get on your lungs and tailoring the chemotherapy to that. And treatment is more effective if you prescribe it for an individual rather than a one-size-fits-all basis. So rather than saying, right, chemotherapy, you have tailored chemotherapy that is linking to your genetic mutation. And that's called pharmacogenomics, when you tailor a treatment to a person's DNA. And it's a huge step forward and something that scientists are working on quite significantly to be able to develop for future cancer sufferers. So far we've looked at the cause, diagnosis and treatment, and now we're going to look at the prevention. Now usually this is quite an easy one to do because it's the government that help prevent lung cancer from potentially growing. How? Well, the government put in place schemes to either encourage people who are currently smoking to quit, schemes to prevent people from becoming smokers, and then schemes to prevent non-smokers from the dangers of secondhand smoke. So you've got a range of statements. And after this, just think, has the government's focus changed over time? You've got a range of statements here. I'm going to go through these. Remember, it's either going to be 1, 2, or 3. So the first one. In 2007, the government banned smoking in all workplaces. People were no longer allowed to smoke in pubs, cafes, restaurants, and offices. Well, firstly, you can say that is protecting non-smokers. That's number 3. But you can also say that it might encourage people to quit if they go out and they can't smoke. So it might, when this happened in 2007, there was quite a few people that decided to quit because actually it was going to be more beneficial for them. In 2007, the government raised the legal age for buying tobacco from 16 to 18. They did this to reduce the number of teenagers who smoked. This is preventing people from becoming smokers. In 2015, smoking was banned in cars carrying children under the age of 18. There is significant evidence to suggest that secondhand smoke has a negative impact on health, especially children, mainly because their lungs aren't fully developed. Although some argue this is an attack on personal choice. Others argue that the child has not chosen to smoke. This is protecting the child from the dangers of secondhand smoke. Now, there's been a few issues especially about the age of 18, because if you can buy tobacco at 18, why should you be banned from under the age of 18? I mean, I guess because it's 18, the legal age. But a few people have questioned, between the age of 16 to 18, you have your own choice if you sit in a car with someone that smokes. It's something that really does cause debate. Right, education to discourage young people from smoking is now included in schools. I mean, that's 3, protecting non-smokers, and 2. Increasing tax on tobacco products to introduce to encourage people to stop smoking. I mean, that's 1. If the price goes up, then it might encourage people to stop smoking, but also it might prevent people from smoking if they see how much it is. Health warnings are on packs of cigarettes. Now, this is a very outdated pack of a cigarette because now they're all blank. You're not allowed any you're not allowed to show any branding on cigarettes anymore. But these health warnings are still on them. So this could do a range of things. Mainly, it's encouraging people to quit by seeing that smoking clogs the arteries, causes heart attacks and strokes. then it might encourage the smoker to say, nah, I'm not doing this anymore. The ban on tobacco advertising began with a ban on cigarette television advertising in 1965, and the government banned cigarette advertising in 2005, including sponsoring major sporting events. So Formula One used to be sponsored by cigarettes, snooker used to be sponsored by cigarettes. That was banned in 2005. So what's that doing? I mean, if anything, it's probably preventing people from becoming smokers because they can't see it all the time, maybe convincing, maybe possibly persuading and encouraging them. The government's produced campaigns to advertise the danger of smoking. These include highlighting the impact of pregnant women, the number of chemicals included in cigarette smoke, and statistics about the health impacts. So what's this doing? Well, it's definitely maybe encouraging current smokers and protecting non-smokers. Government research suggests that it's important to discourage young people from smoking. I mean, that's preventing, it's stopping young people from becoming smokers. This one here is an anti-smoking campaign. Every time you smoke, your blood gets thick and dirty with toxins. That is definitely something that's trying to prevent people from becoming smokers, but also trying to get people to quit. And another NHS campaign, if you smoke, I smoke. That's I mean, that might be encouraging people to quit, especially parents, because this is obviously a child's writing. Okay, so just need to remember 3 of these for the exam. That is the end of modern medicine. You've got everything you need for the lung cancer unit, piece of work. Now, at the end of unit recall quiz, I'm just going to put some questions up that will help you revise medicine. It's not all of them. It definitely won't get you a top grade if you know these 10 questions, but it's something that definitely will help you. Name the scientist who discovered the structure of DNA. Give me one reason why penicillin was found by luck. What was the name of the first magic bullet? 3 types of technology used to diagnose patients since 1900. When was the NHS formed? Give one problem of the NHS when it first started. Name 3 people who helped develop penicillin. In 1990, scientists tried to map out DNA, known as what? What was different about the electron microscope? And name 2 treatments from the Middle Ages. If you answer those, great. That's a good little bit of revision over modern and a little bit of Middle Ages as well. But that's it. That's the last lesson for Medicine Through Time. If you look back through the YouTube channel, you'll be able to see all the lessons from medieval to modern.